Moving right along with our program, we have our spokesperson for Ebola Be Gone. You've seen him all over the news. He said he got plenty number now. That's Samuel Aboh. He was the creator of the Ebola Be Gone media campaign. I said, the man bless you. But it was because of Sam's action. I hooked up with Sam because I saw that this young man had the fire to want to see change happen. So he's going to really explain to you what the youth are pleading. Samuel Aboh.
Ebola? Ebola? From Liberia? From Mali? From Guinea? From Sierra Leone? From Africa? Ebola? Good afternoon, distinguished guests and members of the press, brothers and sisters, friends and all those who have come to listen to our voices. We are here in support of educating our community and providing assistance to those affected by the Ebola virus in West Africa. I thank you all for being here today. Ebola! It is not often that we are able to gather different communities together in our state capital. Although it's unfortunate that we have to do so under these circumstances, I'm very delighted to see so many people, so many faces here today, because it shows our community and the friends of the community and the world that we care about what goes on across the Atlantic and how people here can help those affected. As many of you have heard in the news recently, West Africa is in the midst of fighting Ebola. In the nearly 40-year history of this disease, it is by far, in terms of numbers of cases and death, the worst. As it stands today, the World Health Organization has estimated 1,711 reported cases, including 932 deaths in the countries of Liberia, Sierra Leone, Nigeria, Guinea, and Mali. Many people who sit at home and hear stories on the news believe that it's not our problem to fix and that we should just sit and leave it to the Africans over there. But what a foolish way to brush off such concerns. Why should we just turn our heads away and let them deal with it on their own? Isn't that our social responsibility too, as human beings, to offer help when vast numbers of people are suffering, especially knowing fully well that we have the tools to do so and to help them? Is every life not valuable? I admit that there are many problems that we need to fix and that they aren't fixed, but as I see it, this time will be a great time to help, and there is more than good enough reason to show support for those people who are in need of effective treatment and medical supplies. Yes. Liberia, Guinea, Sierra Leone, Nigeria, Mali, they each have their problem, but I would like to emphasize that the Ebola virus is an enemy that we can help to defeat. If we put in the effort, we can defeat it. The people of these countries don't have all the resources to combat this foe, but we do. Efforts to halt the spread of the deadly virus have not been effective and quick enough. I'm sorry. You may say to yourselves, how could we help? Their needs are so vast that what we do here won't matter, but actually they do. Aside from sending them health and sanitary supplies and using social media to spread the worldwide messages about Ebola, one of the things that we can all do is tell our leaders that we need them to work with our country's leaders and international organizations to respond with a solid plan that raises awareness of the virus, that educates the citizens about prevention and transmission, and work with both local experts and external experts about how to deal with the epidemic properly. These are formidable tasks, but they are not impossible. Furthermore, There are other types of support the communities over there need. For instance, the staff who treat the sick back home in Liberia. Do we not care about national staff who work tirelessly to aid these victims? Do we not care about the staff whose work is emotionally draining and stressful? Let us pay them accordingly. There are facilities for isolation and supportive therapy equipped with proper devices and tools. Here, over there, they are not adequately staffed. Do these facilities have reliable electricity or clean running water? Let's ensure that these places in Africa are safe to operate, have appropriate equipment and a good number of staff support. This is where our leaders here with us come in. I hope you can all understand that you are vital to represent our voices when you go to speak with your colleagues and other public figures. Your assistance is greatly needed. So all of the people here right now, I would like to emphasize another important thing. We are united for Africa. We are united for our communities because we can't win the fight if we march alone. I want to say a special thank you to Uncle Patrick Marsh, we call him Uncle as a form of respect, to Kwamasa, our champion throughout all of this, to Sister Lane Parker, to Auntie Miara Dorley, the mother of the late Sergeant Maxwell Dorley, to Sister Howard Vincent, and all of our elders for putting their arms around us, the youth, and guiding us with their wisdom through this movement. As I close, I'd like to quote Herbert Humphrey. The moral test of government is how it treats those who are at the dawn of life, the children. How it treats those who are in the twilight of life, the aged, and how it treats those who are in the shadow of life, the sick, the needy, and the handicapped. Thank you very much.